As Dr. Alexander Scott mentioned earlier, and this is Tim White's comment, 2 residents at the Veterans Home who have tested positive for COVID-19 have died. Staff members have told us there is a shortage of workers and PPE there. What is your understanding of resources at the home right now?
Yeah, it's definitely a place where we are focused in terms of making sure that the adequate PPE is there and that we're responding to the staffing needs. Sometimes it can happen quickly and the message can come through that someone isn't available to come in for their shift, but then work is done in collaboration and they're able to address that. So that's something that we're in constant communication with the Vets Home about, as well as the other nursing facilities, to help support them in coming up with the solutions for stable staffing. And I really credit our team that the governor referenced earlier in helping to make sure that we have personal protective equipment as a state. Our priority is the healthcare workers in hospitals as well as in our congregate care setting nursing homes. So they know, and we are very quick to respond whenever additional PPE is needed, that we get it to them. So that's been our focus.
Elizabeth McNamara asks, the 10,530 cases of COVID-19, are they all test-confirmed cases? Is there any use of presumed positive COVID cases on the data dashboard?
So yes, Elizabeth, these are the 10,530 cases that we have tested that we know of. And it's really important to use that message to say if there's anyone out there with symptoms of any kind, knowing that it can be a wide variety of symptoms for COVID-19, please do not hesitate to get tested so that we can support you. That is when the test works the best. That message stays the same. When you have symptoms and you get tested, that gives us the most accurate results for being able to respond and help you get isolated and your contacts get quarantined and stop spread of the virus to other people, knowingly or unknowingly. There's no longer a reference to presumed positives for cases. That was early on. Our state health laboratories have done the validation processes immediately, very early on, and every case that we have is a positive case based on our laboratories' identification of it.
Nancy Thomas of RI News Today has a similar note and also question. We hear every day about specific problems at the Veterans Home. As we see a consistent majority of deaths each day happening in nursing homes and group homes, what whole system change is being looked at to stop this steady tragedy of 10 to 20 deaths a day continuing?
It's an excellent question, Nancy, and something that we are addressing on a daily basis. We had even an extensive discussion with the governor today. There are always components of addressing what's urgent now and helping to make sure system-wide that there is workforce stabilization. I've shared some of the policies and regulations that we removed barriers so that we can get people into the workforce to be able to support. I want to continue to encourage anyone who's taken advantage of those opportunities to show up and help us in shoring up the workforce in our nursing home settings. We also are going in to make sure they have the infection control support, the PPE support, and what's needed to address the immediate. We also want to look forward to seeing how the stabilization can occur at a system-wide level for the long term in Rhode Island. As COVID-19 is here, this is something that's critical because we have a medically and physically fragile community in a congregate setting. So we want to apply all of the elements of what we're doing for the immediate and the long term to help make sure that we have a system-wide response and helps address this ongoing challenge.